My name is Dr. Brad Ray. I'm a sociologist and senior researcher at RTI International, and today I'm going to discuss research published in the July edition of the American Journal of Public Health titled Spatiotemporal Analysis, Exploring the Effect of Law Enforcement Drug Market Disruptions on Overdose, Indianapolis, Indiana, 2020-2021. We've been conducting this research with funding from a CDC R01 grant called an iatrogenic study of drug seizures and overdose. Iatrogenic effects refer to unintended consequences where the original intention was to help or improve. We believe this accurately describes unintended outcomes from drug enforcement. We're a little over halfway through this 3-year mixed method study, which first takes place in Indianapolis and then Detroit. In terms of background for this project, I was a professor at Indiana University in Indianapolis for about 7 years, where I started a project with the deputy coroner to collect real-time toxicology results on all accidental drug overdose deaths. As you can see, like many counties and many communities across the United States, fentanyl is driving the escalating number of overdose deaths in Indianapolis. Before fentanyl was widespread in Indianapolis in 2013, in what we generally refer to as the second wave of the overdose epidemic, I was part of a researcher-practitioner partnership with the chief of police in Indianapolis to provide naloxone and training to law enforcement. Dr. Dan O'Donnell, head of the Indianapolis EMS, led those training efforts, and together we studied some of the first implementation of naloxone to police. Several years later, in 2017, Dan and Tom Arkins, the IEMS informatics specialists, said to me that they noticed increases in overdose following police drug raids. They said that sometimes they'd order more naloxone to prepare for increases in that community. This idea that drug market disruptions are associated with overdose resonated with me as a critically important research question given the ongoing and persistent epidemic in the United States. However, this idea isn't necessarily new. In this 20-year-old report, the Department of Justice outlines how disruptions in the prescription drug supply were going to cause increases in overdose more than a decade before they occurred. There have also been several studies assessing the overlap between aggregate numbers of seizures of drugs by law enforcement and overdose in the community. And in 2019, this study from the International Journal of Drug Policy published sentiments from an EMS provider in New Hampshire that were nearly verbatim to what I heard from practitioners in Indianapolis. Localized spikes immediately following police interdiction. And it was these localized spikes, not aggregate associations, that immediately occurred following interdiction events that my team and I sought to explore further. To examine this, we looked at 2 years of data, 2020 and 2021, and to measure drug market disruptions, we used information on substances logged into the property room, the police property room, which contains the time and location of the event along with the suspected substance being seized. And I want to heavily stress that term suspected here because none of these substances went through confirmatory testing and at best represent police guesses based on experiences and observation. And we recognize this is a major limitation of our findings. However, this is the best available data to test that central hypothesis at the community level because it had information on when and where these overdose events occurred. In total, there were more than 20,000 drug-related pieces of property in the data, but nearly half were cannabis, which we removed. Many were only paraphernalia, mostly syringes, which is a felony to possess in the state of Indiana. Some were found or part of controlled buys. Some were detected at places like airports, so it wouldn't have had an impact on that surrounding community, and some were just missing data. This left us with about 2,000 opioid-related events and 3,000 stimulant-related events. And what's important to remember here is that these don't represent just the big drug busts, if you will. These represent the routine policing enforcement of illicit drugs. And you can see here about 7 of these opioid or stimulant-related seizures per day. To measure overdose events, we included all accidental drug overdose deaths. As you saw before, the vast majority are opioid involved. And we also used EMS call for service data to look at non-fatal overdose. So our non-fatal overdose measure are all overdose calls for service, including those where naloxone was administered. And then we look separately at just the naloxone administration. And you can see there are about 2 fatal overdoses per day and 17 non-fatal overdoses per day. The analysts on our team use a method called the Knox test, which is an epidemiological tool that looks at the spatiotemporal clustering of events. While I did not lead this analysis, I've created these figures to do a better job of explaining how we used the Knox test in this study. First, we created spatial radii based on prior work looking at police call for service data. So you could imagine overdose events occurring within a radii of 100, 250, or 500 meters. Next, we centered our radii around the drug seizure events so that we could determine how many overdoses are occurring within that area of a seizure. Next, we added in a temporal component. So we're looking at events that occurred before and after that drug seizure event, specifically 7 days, 14 days, and 21 days before and after. Then our lead analyst, George Moeller, developed a pre-post test to determine whether or not there were significantly fewer or significantly more overdoses within those spatiotemporal parameters. Here are the Knox test results. You can find them in the paper as well, which is publicly available. But I want to illustrate that we looked at both opioid and stimulant-related seizures, which you can see on the left-hand side, and we looked at both of those seizure types across all 3 outcomes: fatal overdose, non-fatal overdose, and naloxone administration. You can see here that there was a significant increase for fatal overdose deaths and naloxone across each of the 3 space-time parameters for opioid-related drug seizures. Here we created bar charts to show the change before and after drug seizures for overdose and naloxone administration. And you can see that within 7 days and 100 meters, our smallest spatiotemporal parameter, fatal overdoses more than doubled following opioid-related drug seizures. While we're not able to test all of the components of our hypothesized mechanism, what we're theorizing is that people have a known supply and merchant. That supply or merchant can be disrupted in a number of ways, including by law enforcement. However, police know very little of the illicit drug market. Some estimates suggest less than 5%. So people find a new merchant and possibly a new supply. With many drugs, especially opioids, people rapidly develop a tolerance that is quickly lost after a period of abstinence. And with a new and unknown supply, dosing oneself is impossible. And if it's been several hours since last use, especially with opioids, tolerance may have changed. Thus, drug market disruptions could reduce people's capacity to obtain a substance that they can safely dose, given presumptions about its potency. This increases risk of overdose. As I mentioned earlier, this idea of drug market disruptions increasing overdose is not new. In fact, the CDC has a program called the Opioid Rapid Response Program that helps to mitigate harms from law enforcement disruptions of providers on patients. We need to take a similar approach to the illicit drug market by recognizing that this same mechanism occurs. We also need to recognize that decades of interdiction efforts have not resulted in any meaningful reduction in the price or availability of drugs in the community over any substantial period, and may, as findings from this study and others suggest, contribute to increased risk of overdose and death. Thank you for watching this and your interest in this study.